Good afternoon, this is Dr. Doe again. This video is still on alphabetical list of problems and also what kind of problem you need to visit the emergency, what kind of problem you can manage at home, or in between what kind of problem you need to call your physician to discuss and to diagnose. Today we're still on the B list, list of B. Today I'm going to talk about topic of blood and related diseases. So before I talk details, I just like to briefly summarize what kind of condition related to the blood you need to go to the emergency room. Of course, first of all, bleeding after the trauma, that's very obvious. And there's the internal bleeding is also, some of them are kind of emergency, such as the vomiting blood, because the varicosis of the esophagus vein, or hemoptysis, which means cough of blood. It's not like a streak, but it's just pooling. The whole sputum is red stained. It's not a streak, pink or something, but if it's a large amount of blood, you need to go to emergency. Or the blood per rectum, either bright or the tar, black. The tar stool means the bleeding from the stomach or small intestine and passing down or digested, so turn color to the black. Or the bright blood per rectum, just the lower digestive system have the bleeding. So these are the signs you need to go to the emergency room. Of course you know it. So let's talk about the blood. Okay, if I tell you blood is a tissue, is a connective tissue, can you believe it? We imagine tissue is solid, but this is the only tissue which is liquid form. Of course, there's a component of plasma, which is the ground substance, the plasma, and also the cellular component of the red blood cells, white blood cells, and platelet. Okay, so the plasma is very important. It contains the albumin, which is maintained normal oncotic pressure, you know it, and also nutrition, and also globulin. Globulin either serve as immunoglobulin, for example, or a very important function of globulin in blood is transport. A lot of hormones, for example, need to be transported from one organ to another organ through the blood, and this globulin serve as the transport protein. And there's some other coagulation factors, for example, which is synthesized from the liver. So if any of these three major components of proteins are not normal, might have impaired function. For example, if the liver has disease, then which means the albumin, the malnutrition, for example, the liver disease or malnutrition, you have albumin deficient. That means your body cannot maintain the normal oncotic pressure, and albumin has another functions like nutrition, and transport. So if that's the case, liver disease has this very serious problem. For the globulin, if you have globulin problem, a lot of hormones cannot be transported. That's also, and particularly if the immune globulin deficient, then impaired the immune function, susceptible to the infections, either virus or bacteria. A coagulation factor are proteins synthesized from the liver. So having said that, if you have liver problem or you have genetic disease impose the risk of deficiency of coagulation factor, these people tend to have risk of bleeding, etc., etc. So these are the plasma. And the cell component, of course, we all know red blood cells, white blood cells, and platelets. The red blood cells, we already talked about it. It's very important to transport oxygen, right? If the red blood cells not produce enough, or lost too much, or internal damage, like hemolysis, or bleeding, or anemia. So these are the red blood cell disease could cause the hypoxia. Okay, and I'm going to talk about the the white blood cells today, okay, so unrelated disease, because I haven't mentioned before. So basically, white blood cells are different kind. The major two important ones are the neutrophils and lymphocytes. Neutrophils is serve as the first line immunity, okay. Really, it's for example, there's the invasion of bacteria or the virus. These neutrophils will increase, especially bacterial infection. Why? Because neutrophils produce a lot of enzymes, just engulf the bacteria, just swallow them and digest them to break them down, to deactivate the bacteria. So a lot of neutrophil disease, like either genetic, because of the oxidase or the enzymes deficient, can cause malfunction of neutrophils. That imposes the great risk for the infection, particularly bacterial infection. Okay, so what is the? How do you know? Usually, if you have the infection, you will know high fever, especially bacterial infection. I mentioned you feel sick, fever is high, and if you go to the physician suspect that you have bacterial infection. Then they will draw blood and do the CBC, complete blood count. Usually for the bacterial infection, the white count increase greater than 10,000. The normal range is between 5,000 to 10,000 for average. So if beyond that, basically can confirm it's the especially with associated symptoms, can confirm you have bacterial infection. So then treating accordingly. The other white blood cell problem is if this white blood cell not enough, neutropenia, less than 5,000 or particularly less than 3,000. That is the condition that increase the risk of infection I just mentioned. So this is the white blood cells. The neutrophils, okay, and the other neutrophils like the monocytes, which becomes a macrophage to the tissue, and those serve the same function as neutrophils to engulf bacteria, to digest it, also present the antigen to the other immune cells. I'm not going to talk about details about that, the monocytes. And there's another important one, the lymphocytes. I mentioned previously, there are T cells and B cells. They have involved in the cellular immunity and humoral immunity. The B cells, for example, produce antibody, either bacteria or viral, or just any cells not normal, and then the body responds. So the B cell proliferated to the plasma cell, produce different antibodies, A, D, E, G, M, etc., etc. So the B cells is very important. Especially for the humoral immunity, and the T cells, there are different type of T cells, T4, T8, T memory cells, and etc., etc. So talk about T cells. They're in addition to just regular cellular immunity, which serve the same function as neutrophil or macrophage to directly destroy the bacteria, virus. The T lymphocytes has multiple functions facilitated with the humoral immunity to help the body remember the previously came across of the antigens. For example, that's why the immunization, because the T memory cells, the body remembered this is has previous encounter. For example, you were immunized with the varicella, for example. And then the T cell remembered, oh, this we have met before. So if that's next time the varicella infection exposed, then the antibody is produced and then destroyed. So this is the T cell. And the other important function of T cell is related to the cancer, because there's a surveillance T cell, just patrolling like a police, patrolling the blood. So if that cells is not function well, one of the mechanism is the cancer. Because cancer, remember, cancer is the abnormal cells, either locally or circulate in the blood. So the surveillance T cell just traveling with the blood can identify them and can present them to the other cells to destroy it. If this surveilling function is not normal or decreased, or with age or with other causes, then the cancer is going to develop. So this is one of the mechanisms of the cancer, malignant. So this is briefly, we all talk about the blood, you all know the blood, and this is just a summary of the major function of blood. Not just carry oxygen, not just prevent hypoxia, has so many functions carried on by the blood. So that's why eating healthy, exercise and maintain healthy lifestyle is also very important. So that's conclude my video for this one, and thank you for watching. I will see you next time.